Welcome to the annual Six and Mango open enrollment for our 2016-2017 plan year. Now is a perfect time to evaluate the comprehensive and valuable benefits Six and Mango has available to you and your eligible family members. We offer a wide variety of benefit options so that you can choose the coverages that work best for you and your family. These healthcare benefits are designed to help you balance your work and life and every day. We are very pleased to announce that after vigorous negotiations, we will be moving medical and dental carriers to Cigna. Please review the new benefit information in the following pages as we will be reviewing on this webinar. We also have a new system as far as making the elections. You will need to access the Employee Navigator site in order to make those online elections for this plan year. Further instructions will be provided. Online enrollment is available from September the 16th through September the 20th. Please make sure to read your materials carefully prior to going online and enrolling. Open enrollment is a time for you to review your benefits and select what is best for your individual needs. Please note that during the year, you may only make changes if you have a qualifying event. Qualifying events such as marriage, divorce, legal separation, death, newborn of a child, or your spouse is covered through another employer and they lose coverage, you have 30 days from the time of that qualifying event to enroll or make any changes to your Six and Mango elections. Eligible dependents is your spouse, an opposite sex or same-sex spouse in a marriage where it's legally recognized in the jurisdiction, state, or country where it was performed. Children are covered up to the age of 26, regardless of student or marital status. Employee Navigator. In order to make the elections, you will have to visit www.employeenavigator.com/benefits. When you log in and you see the screen, you will have to input your company identifier, Six and Mango. Once you create your username and your password, you will be able to log into the system and start your benefits. The first page that you will find is your profile page. Please make sure that the spelling of your name, the address, and all your information is correct. Once you have verified that information, please save and continue. The next page is your dependents. If you're adding any dependents to any of your benefit coverages, please make sure on the second screen for your dependents, you are adding that information. Prior to going there, please make sure you have their social security numbers and their dates of birth, as you will need them. After each page, you will see the green button where it says Save and Continue. It is a very easy and user-friendly system. Once you have finalized the enrollment process through a couple of pages, you will see a summary. The summary will show you the plans that have been selected and what your per payroll deductions are for the benefits elected. Once you see that, and if you agree, you will click on the green Agree button, and you are pretty much done, and congratulations, you have submitted your enrollment for this plan year. This system will not only be for enrollment, but for future reference, you will have access to all of your benefit information on this site. At a later time, you will also be able to go in and see and review your summary of benefit coverages, different links to the different carriers that are available to us, and different information as it becomes available. Let's review the two Cigna medical plan options that are available to you. Very similar to what previously had with United Healthcare, we have option number one, which is a high deductible plan, and option number two, that is what we call a first dollar plan because there are co-payments prior to having to satisfy a deductible. So let's cover option one first. Option number one is eligible for a health savings account. This is a high deductible health plan with a deductible of $5,000 with a co-insurance of 100%. Your maximum out of pocket is $6,050 for individual and $12,100 for family. Please note that your deductible and all your copays on this particular plan for any prescriptions are applicable towards that out-of-pocket maximum. So as a reminder, on this plan, you will have to pay for everything until you've satisfied a $5,000 deductible. Once you have satisfied your $5,000 deductible, all of your medical services are covered at 100%. However, if you see your deductible is $5,000, your maximum out of pocket is $6,050. So you may ask yourself, what is the difference of $1,050 if you're saying I am done? The difference of that $1,050, if you look to the bottom of the screen where it says prescription drugs, you have copayments for prescriptions. So once I've satisfied my $5,000 deductible, yes, I am done at 100% for the remainder of that calendar year for everything that involves medical services. However, if I have to pick up additional pharmaceuticals, any prescriptions, I will have copayments. Once I satisfy that additional $1,050 and my total reaches $6,050, I am then done at 100%, including prescriptions, for the remainder of that calendar year. Please make note, though, on this plan, you do have your preventative care that is covered at 100% without having to satisfy the deductible. Those are things such as your physicals, immunizations, your pap smears, your mammograms, any preventative colonoscopies. There are also some medications that are considered to be preventative, such as high blood pressure or cholesterol. There's a smaller list of those. Those will be either a $0 copay, could be a $5 or a $10 copay. Other than that, then everything, including a prescription, is subject to the deductible. Option number two. Option number two is a $5,000 deductible as well with 100% coinsurance. The difference on this plan is, which we will review, you have copayments for different medical services. So there are times where you can actually go through the entire year without having to satisfy a deductible if you do not go to any hospitalizations, whether it's inpatient or outpatient. So let's take a look at this plan. Again, your preventative care, the same as I mentioned on the other plan, is the same for this plan. Physicals, immunizations, pap smears, and mammograms, any preventative colonoscopies, any well-woman exam, everything that is considered to be preventative, including your lab work, is covered at 100% with no cost share to you, the member. Your primary care copayment is a $30 copayment. These plans do not require you to have a primary care physician, nor does it require you to have any referrals so long as you stay within the network. Your specialist copay is $60. Your diagnostic laboratories and your x-rays are covered at 100%. Your labs for Cigna is either LabCorp or Quest, so you do have the option of both. Major radiology is 100% after deductible, so this particular service does go applicable towards that $5,000 deductible. You will pay the contracted amount that Cigna has negotiated with a facility for that MRI, CT scan, or PET scan. So example, if the MRI is $600, and that is a cost rate that Cigna has negotiated, that is what your responsibility will be. That $600 goes towards your $5,000 deductible. Emergency care. Emergency room is $250 copayment, and your urgent care is $75 copayment. There are also things, convenience care clinics, Walgreens, CVS pharmacies, now in the back, have nurse practitioners that can handle minor things that are require immediate attention, but they're not really true life-threatening emergencies, and there's something minor, not so much going to the urgent care. You can use those nurse practitioners, which can also prescribe medications, and only pay your primary care copayment of $30. Any hospital care, whether it's inpatient or outpatient, that is subject to your $5,000 deductible, and then it is covered at 100%. Coinsurance stands for what is my cost share once I have satisfied my deductible. In this particular plan, it is covered at 100%, and there is no cost share to you, the member, once you have satisfied your $5,000 deductible. I'm going to skip over out-of-network benefits for 1 second. Further down, prescription drugs. You have a 3-tier prescription drug copayment plan. So you have $15 for Tier 1, $35 for Tier 2, and $60 for Tier 3. You also have mail orders where you can do a 90-day supply for 3 times the retail copayment. These are the 2 plans that are being offered to you by Cigna. Again, option number 1 is a high deductible health plan where everything goes towards your deductible with the exception of preventative care. Once I satisfy my deductible, I am done at 100% with the exceptions of the copays for prescription drugs, because then I have that additional $1,050. Once I've satisfied the $6,050 for individual or $12,100 for family, I am done at 100% for the remainder of the calendar year. Option number 2, as previously mentioned, I have co-payments pretty much for my doctor's office visits, for my lab and x-rays, emergency room care, and prescription drugs. Anything other than some of those medical services, it will be subject to your $5,000 deductible. On this plan, you also have your maximum out of pocket of $5,000 for individual and $13,700 for family. Your maximum out of pocket does include all the copays, including your deductibles. Everything goes towards your maximum out of pocket. On both of these plans, towards the middle center of the page, where it reads out of network benefits, option number 1 has an out-of-network benefit, but it does have a deductible of $10,000 for single and $20,000 for family, with a 70-30 coinsurance, meaning Cigna will pay 70% of the usual, reasonable, and customary charges, and you, the member, will pay 30%. Maximum out of pocket is $20,000 for individual and $40,000 for family. I highly encourage everyone that due to Cigna's national plan with all the providers that are in their network, that you always utilize your in-network benefits, because you will use more of the discounts that are available under Cigna, and your dollars will stretch much greater. When you utilize your out-of-network benefits, please note that there are some balanced billing. Those providers and hospitals are not contracted with the insurance company. Therefore, they can balance bill you for the difference that is not paid. On option number 2, you also have out-of-network benefits should you wish to utilize them. Keep in mind you do also have a $10,000 deductible for individual and a $30,000 for family, with a 70-30 coinsurance and also maximum out-of-pocket of $20,000 for individual and $60,000 for family. Once again, I highly encourage everyone to stay within the network so that you can use the most of your medical services with the least amount of out-of-pocket expenses for you, the member. The biweekly payroll deductions are in the bottom of the screen for both of the plans. As most of you are aware, and those that have selected the high deductible health plan in the past, we do have a health reimbursement account. A health reimbursement account is an IRS-approved, employee-funded, tax-advantaged employer health benefit plan that reimburses employees for out-of-pocket medical expenses. The enrolled member pays 100% of the first $2,500 of the in-network deductible expenses. After the member meets their responsibility for the in-network, your HRA deductible, the employer, Six and Mango, will reimburse of the next $2,500 deductible expenses for that benefit. The employer will only reimburse a maximum of $2,500 for individual and or family. Copays and out-of-network expenses are not covered by your health reimbursement account. In order to file a claim for health reimbursement, once you have received your explanation of benefit from the insurance carrier, you will need to submit that together with your form to the numbers that are provided on your screen. You also have the ability to open a health savings account. If you participate in the high deductible plan, option number 1, you are eligible to set aside money in this health savings account before taxes and deduct it to pay for eligible medical expenses. Medical expenses such as medical, dental, vision, and anything that is healthcare related. No over-the-counter medications are no longer allowed due to the Affordable Care Act unless it is prescribed by a physician. Choosing your medical coverages, everybody has different needs, so please read your plans carefully and decide for you and for your family members which plan works best for you based on premiums, deductibles, coinsurance, and out-of-network. One coding tip: When you're scheduling your preventative visits for either plan, since those are covered at 100%, please make sure that when setting your appointment, you are saying you're scheduling your appointment for your wellness, your annual well woman exam, or for your annual physical. This way they know upfront that you are scheduling your appointment for your annual visits, and therefore everything will be covered at 100% with no cost share to you, the member. How to stretch your healthcare dollars at your doctor's office? Make sure that you ask questions and that you understand completely. Ask your physician about home testing and monitoring devices such as blood pressure and diabetes. Keep records of all of your appointments and outpatient visits, which include your provider name, procedures, and tests performed and medications received for purchase. Online on mycigna.com, once you become active on the system, you will be able to keep track of your explanation of benefits, and you will receive and be able to compare. Also, there is a comparison tool where if you need to have a diagnostic test, you will be able to go in and with proper codes see where it is least expensive for you to get, an example, an MRI. If you do an MRI at an independent diagnostic center instead of a hospital, the diagnostic center will be less. So it puts the responsibilities a little bit more on the member so we can be educated healthcare consumers. Cigna Advantage, staying healthy. Cigna also has a lot of different staying healthy tools to help you. You have exercise, weight management, stress management, and smoking cessations. Cigna Nurse is also on call 24 hours a day, where you can call ask for any medical questions in the event of a need during the night hours. You also have your voluntary dental plan that is also going over to Cigna. This is a PPO plan. Your preventative dental services, on your screen, your benefit overview, you will see that your preventative services, oral exams, x-rays, and any cleanings are covered at 100% with no deductible. Your basic and major services do have a one-time deductible of $50 for an individual or $150 for family. Once I've satisfied that one-time $50 deductible, then my basic services for things such as filling, oral surgery, endodontics, and minor periodontal work is covered at 80% after the deductible. Any major services, including crowns, dentures, and bridges, will be covered at 50%. Your plan maximum is $1,500. Your $1,500 is from January 1 to December the 31st. These are also based on contracted amount, so therefore by utilizing in-network dentists, your dollars will go stretch a lot further. Your out-of-network lifetime or plan maximum is $1,500. You also have an orthodontia benefit of $1,000, and this is only for children. Your biweekly payroll deductions are in the bottom based off your tiers. Once again, this is a PPO plan with 100% preventative coverages, 80% covered for your basic, and 50% for your major services. This plan also has out-of-network benefits, just like your medical. Please make sure that you stay within the network to make sure that your dollars are used more wisely with the contracted amounts that are already discounted by Cigna and the negotiations they've made with each dentist. By utilizing your out-of-network for dentists, since they are not contracted, again, you are exposed to balance billing. On the following page, you have important terms to know. Gives you definitions on what a deductible is, what a coinsurance, and your out-of-pocket, some of which we have covered this morning. In the back of your book, you will see your directory of resources. Your directory of resources include information on Cigna. If you're searching for a provider, you can go to Cigna.com and search for a provider, and your network is the Open Access Plus network. Once you're actually a member effective October 1st, you will be able to log in to www.mycigna.com. There you have the numbers for Cigna, for medical and your dental member services, pharmacy home delivery, and behavioral health. You also have in the center of the page standard insurance company that is for your vision, your life, your long-term, and your short-term disability. Also on the bottom of this resource page, you will have the information to our consultants. You have Evelyn Alvarez, and we have our dedicated account manager, May Stauffer. For any day-to-day services, you are free to call Cigna directly if by chance you do encounter any issues, which we hope we don't expect any, but with authorizations or you have questions regarding a claim and you're not quite sure how that was processed, they are there to assist you through that. This concludes our webinar for today with the open enrollment for SIX and Mango for our 2016-2017 plan year. Thank you.